Good evening. Myself, Dr. Meghashree Deshmukh from Shushrusha Hospital, icsi and Test Tube Baby Center, Nanded. I am here to give an awareness regarding surrogacy. This is Ganesh festival. First of all, माझ्याकडनं सगळ्यांना शुभेच्छा गणेश चतुर्थीच्या निमित्ताने. बाप्पा आले म्हणजे आपल्याला बाप्पाच्या आगमनासाठी काहीतरी सगळ्या लोकांना, जसं टिळकांनी सगळ्या लोकांसाठी एक सोशल अवेअरनेस म्हणून गणपती बाप्पा हा कार्यक्रम सुरू केला सामूहिक, तसंच मी आपल्याला सर्वसी संबंधित काही माहिती देण्यासाठी इथे आज आले आहे. तर व्हॉट इज मेंट बाय सरोगसी? सरोगसीचा अर्थ होतो सबस्टिट्यूट, म्हणजे त्याच्या जागी कोणी असणं. तर सरोगसी के लिए क्या करना चाहिए, किसके लिए सरोगसी, क्यों सरोगसी और कौन से पेशेंट में सरोगसी करना चाहिए? Surrogacy means substitute means surrogacy is an agreement in which not only the intended parents whom they want to have a surrogate, they go ahead with surrogacy. It is a lawful agreement in which the couple wants to have a child through a surrogate mother. That is, in spite of his wife, he will have some other female who would be bearing his child in her own womb. That is meant by surrogacy, and that is through a legal agreement of both, that is the intended parent and the spouse of the surrogate. So surrogacy comes from the Latin word substrate, म्हणजे in place of. So coming with the point of surrogacy, so which patient should go for surrogacy? First of all, surrogacy is meant for these patients who want to rent a womb, as it is called in Hindi or Marathi. So this womb is rented. It is not like a renting a womb. It is like, in spite of his wife, he is taking some other female uterus as a substitute for bearing his own child. So there are two types of surrogacy. First, the old one is traditional surrogacy, which is banned, and the one which is currently used, it is gestational surrogacy, in which either of the sperm or ovum, either of the intended parents give their gametes to form an embryo, and that is transferred in the surrogate. So gestational surrogacy is also called as altruistic surrogacy. In this altruistic surrogacy, the surrogate gets the medical expenses only. She is not exploited for money's sake. Whatever she bears or whatever she goes through in 9 months, she is paid for those expenses, and her medical care is also taken off. While commercial surrogacy, in spite of having the medical expenses and routine bearing of the child, she gets extra money for her own benefit. That is commercial surrogacy. So government has given approval for altruistic surrogacy, which is more important than commercial surrogacy. But the thing is, the law has come into picture in case of surrogacy. So what laws are there in surrogacy? The surrogate should be more than 21 years of age but less than 35. She should at least have her own child. She should be married lady, and in last 6 months she should not have a blood transfusion nor had extramarital sex. Her spouse should be willing to go for a surrogacy, and it should be a legal agreement. She is not allowed to abort her child unless it comes under MTP law. So these all laws should be fulfilled by a surrogate, and the intended parents, they should be staying inside in a relationship since 5 years. That is, they should be staying in India since 5 years. That also together. And either of the couple should have a problem in bearing a child. As it is said, what are the indications of surrogacy? In female, if the uterus is absent, then if the uterus is, there are Asherman syndrome, there are many adhesions inside the uterus that you can't put an embryo. There is no place inside the uterus is stuck up. In spite of repeated abortions, repeated curettage, the baby is not withheld or the embryo is not withheld. The fourth thing is, in cases where the uterus is removed due to hysterectomy. Fifth is, if the mother is having medical disorders like severe hypertension, diabetes, severe asthma, so that she can't bear her own child. In that cases, she should go for a surrogacy. Last but not least, if she is having her own child, but the child is having some mental disorder or is mentally retarded with cerebral palsy or having some metabolic disorder which are not compatible with life, in those cases, they can definitely go for surrogacy. Then how they proceed with surrogacy? There are many centers in India which go for surrogacy. As our Shushrusha hospital, we are providing services for surrogacy, and patients who have recurrent implantation failure, recurrent test tube baby failures, recurrent icsi failures, and all those indications as I have told, should go ahead with surrogacy. So in short, what we do, we make an agreement of the intended couple. Means if the couple wants a surrogate, we provide a surrogate. We see to it that her blood tests are done, then her medical checkup is done, her psychological setup is evaluated, that she is psychically balanced. Then third thing is she is not allowed to abort her baby. She stays with us for 9 months, or she can stay in her house if she is close by, or in a surrogate home, so that 9 months we can follow her. Lastly, when the surrogate delivers, the delivered child gets the birth certificate in the name of intended parents, that the father's and mother's name who want to have that surrogate, that baby through a surrogate, their name is enrolled on the birth certificate, so that they have a satisfaction, they have their own genetic baby. In that case, either the sperm or the oocyte can be used of the male or a female partner, but a donor embryo can't be used in a surrogate. That is the condition. Now laws are stringent in case of surrogacy, so these laws we follow, and then we go ahead with surrogacy. Maximum patients who are less than 50 years but more than 21 years, and who have repeated test tube baby failures, repeated icsi failures, repeated abortions, or you have mentally retarded children, or who have uterus which are bad in shape or uterus removed, they should definitely go for surrogacy, so that this is a boon for these parents, that they can have their own genetic baby. Thank you.